A CDC panel is recommending Pfizer's COVID-19 vaccine for children as young as 12. The move comes just 2 days after the FDA extended its emergency use authorization to the younger age group. Health experts say the recommendation will help protect children as summer activities begin and bring Americans closer to achieving herd immunity. Nearly half of the U.S. population has received at least one dose of a COVID vaccine. More than a third are now fully inoculated. We turn to Janet Shamlian for the latest.
This is one more giant step on our fight against the pandemic.
Tonight, it's official. The CDC recommending the Pfizer vaccine for children 12 to 15 years old.
You might have a headache and you might feel tired, okay?
But some states started before the official okay. This clinic in Fayetteville, North Carolina, vaccinated kids in that age group Tuesday after authorization by the FDA.
It wasn't painful. It felt like a little tap on my shoulder.
The American Academy of Pediatrics is out with a new advisory today recommending the vaccine for all children 12 and older as soon as possible. One reason, children 17 and younger made up 18% of the nation's COVID cases in April.
While we're fortunate that children aren't as seriously affected as adults on average, there's a lot of disease that's still going on and serious disease that does affect kids.
Terry Herod took her 12-year-old son Bryce to get his shot in Atlanta's football stadium.
Every day we would get up, we would look at the website and see if it was available for 12-year-olds. And yesterday was the first day it was.
Herod says she signed him up and they were in line 30 minutes later.
What's it been like for the last year having little contact with your friends?
Well, I didn't get to make as many memories with them because I've been quarantined.
Bryce is the last in his family to get the shot, offering his mom a sense of relief.
We want to get back to a more normal way of life, and so we want to go on a family vacation. He's going to summer camp. The kids are going back to school in the fall.
In the push to get older teens vaccinated, incentives like this one in the San Francisco area. The first 100 in line got a free Chipotle or Starbucks gift card.
More than 200 12 to 15-year-olds were vaccinated here at Atlanta's Mercedes-Benz Stadium on Tuesday. No final count yet for today because they are open late. And kids who come here for their first shot can go just about anywhere else for their second if they're out of town when the time comes. Lana?
Janet, thank you. For more, I want to bring in Dr. Stanley Perlman. He is a professor of microbiology and immunology at the University of Iowa and also a pediatric infectious diseases physician. Dr. Perlman, always great to have you on the show, and particularly so as we're talking about children. As I mentioned, the Pfizer vaccine has been endorsed by the CDC for adolescents as young as 12 now. And this comes as the agency says kids are starting to make up a larger number of COVID cases than earlier in the pandemic. Do you believe that the CDC's recommendation will turn around this trend?
I hope so. It depends on children that age getting vaccinated, and we hope that eventually children even younger will be vaccinated. Certainly, we want to decrease the number of children who are vulnerable. We have these new variants coming out. Fewer people who can be infected, the less likely the variants are to be able to keep growing in numbers. And we know these children sometimes get serious disease, and we want to prevent that. So I don't know if it'll turn around immediately, but it's certainly a right step towards seeing that things are turned around and we return to more normal times.
And there are a lot of schools that require immunizations for their students even before the pandemic. So I'm wondering, looking ahead to the next school year, do you think schools should mandate that kids who can get vaccinated against COVID do?
Well, I think that we can't ask that question until the vaccines are actually licensed. Right now, they're still under emergency utilization. But once they're licensed, I hope that they will be mandated in schools, because this is, again, the best way to get the vaccine widely spread and to get people back to normal. The best thing would be to have people have less doubts about the vaccine, to have no vaccine hesitancy. And that's probably the major thing now that's limiting the number of people who are vaccinated. So it's a multi-pronged answer to that question.
Well, the CDC also now says that it's okay to administer the COVID vaccine along with other vaccines. Tell us why this is so significant.
Well, because especially for adolescents, getting them to come into the office may not be straightforward. And for some communities where getting to the doctor's office isn't easy, is not straightforward. So anything we can do to make it more likely that children will get vaccinated against both COVID-19 and against their routine immunizations is really important. We know over the year of the pandemic, a lot of children missed their immunizations, and we need to catch up.
So if there's a parent now who has a 12-year-old, 13-year-old, et cetera, and are looking at their annual vaccinations, would you recommend that they do it all together or space it out, or really it's just at that point up to the parents and the child?
Yeah, I think it's up to the parents and the child to see where they are exactly, because right now, if a child can get the COVID-19 vaccine, I would do that and not wait to see when they need to be administered the other vaccines. On the other hand, if they are falling behind in their other vaccines, then it's fine to get them all together. So it's really a parent decision, but I think it's a good idea to get them all as fast as you can.
And that, of course, assumes that the doctor's office actually has that vaccine.
Yes.
I want to switch gears to a heated showdown on Capitol Hill on Tuesday. Dr. Anthony Fauci and Senator Rand Paul clashed over whether the National Institutes of Health funded gain-of-function research in China. This is not a phrase that is bandied about in normal conversation. So can you explain what gain-of-function research is and why it is controversial?
Well, what it means is that you have one has a virus or a bacteria that causes a certain amount of disease, and now what you've done is in the laboratory, one has manipulated it so that it causes a more robust disease, a worse disease. So that's what the idea is. And the argument that people who do it argue is that this is the best way to learn about how potential pathogens that are in the community can work. So that's why people do it. But the fact is that we don't actually do gain-of-function research. Sometimes we do things to try to figure out how things work, but there's very little evidence for actual gain-of-function research of people making pathogens that are worse. The nearest case was back flu several years ago, and in fact, a virus was created that was attenuated, that didn't grow as well as the original virus, even though it could spread to infect human cells. So it's all it's all controversial about whether this has actually occurred. Certainly, if it does occur, one needs to carefully look that over, and those kinds of experiments need to be regulated as they're supposed to be.
Dr. Fauci also made a bit of news because he has denied the theory that the coronavirus came from a lab in Wuhan, but he says that he supports an investigation into China's lack of transparency. Tell us a little bit more about what he's referring to and what would a possible investigation look like?
Yeah, so this is a really important question because we want to know where the virus comes from, because if we're going to prevent another coronavirus outbreak or another kind of a virus causing a pandemic, we need to understand where did it come from. So there's the general, among people who do the coronavirus research, we know that and the general public, we know that viruses like this are found in bats. So the question is, how does it get from bats to people? And the two models or two explanations that people are giving now, one is that it came via growing in humans at low levels elsewhere, or it came through intermediary animals. The other possibility, or the other thing that's raised, is could this be from a lab? Because the Wuhan lab is not very far from where the Wuhan market is. So those are the two arguments, and we have no evidence for either one right now. The evidence for going from a bat to a human, there's very little evidence. We haven't found evidence of it actually having migrated from bats to humans. There's possible explanations for that, but we just don't know. And the same thing for the lab origins. We just have no evidence that there's lab origin. So that's why the argument that we need more data really important. It's from many, and the other argument about the lab origin is this has actually changed over time. So originally, when I first heard about this a year and a plus ago, people were talking about, is the virus been engineered? Well, I don't think that's possible. I think that we don't know enough to do it. But then if that argument changes into, could a virus that's exactly like SARS-CoV-2 been in the Wuhan laboratories and gotten out? Well, that's changing the goalpost a little bit, because now we're saying that the virus is there. It's already gone through humans, gone through animals, and works well in people, and it leaked out. That's much harder to disprove. So that's why what Dr. Fauci said is what I think is correct. We need more information. What we have to do is we have to not politicize this. We have to try to get at the origin, because it's more than a political question. We don't want this to happen again.
Absolutely. So important as we try and make sure that future pandemics don't ravage the world as this one has. All right, Dr. Stanley Perlman, as always, thank you.
Thank you.